as we began to go around in our different emergency centers that we have, and just listening to clients talking, it just became very apparent that one of the things that we were feeding them or doing different things, helping them, but one of the biggest challenges they had was access to health care, or at least to begin, especially in the immigrant communities, to trust. And we knew that the churches and the parishes, many of the immigrants would trust, and so there was an automatic trust level there. So that's where we began to have the health fairs in the different parishes and the different communities.
Most of the folks that come to us have no insurance, no medical cards. So what we try to do is get them the medical screening and exams that they need while they're here, and then they check out at the end of their exam cycle, and they sit one-on-one with the doctor and go through their exam findings. And we give them referrals for community agencies that either have free medical services or sliding scale.
There's a lot of things that are offered as a total package, which you would expect from Catholic Charities, because it isn't just a health fair or a place where you get a bunch of brochures and leave. There is a whole sense of trying to say, what would the families in that community kind of need, and what are the resources that we provide right in the local community, right in the area. And so each health fair has its own particular part, because it affects a different part of the city, where our local resources are, and how we might be able to reach out and help them. So by expanding, my sense is that Chicago has always been, since the turn of the 19th century, a place of immigration, migration around the United States. That will continue no matter what our government ever does. And so my sense is the need will always be there, because even though the Affordable Care Act, there's 10, 12 million people automatically are not a part of it. So the people we're taking care of really are not in that Affordable Care Act, and as far as universal health care. When the immigrants come to the United States, they have a fear of government for a variety of reasons. Whether they came from Eastern Europe, they come from Africa, or they come from anywhere in Mexico or Central America or South America. So the idea about the presence of the church, even though they might not be of that religious tradition, there is a sense that the church will take care of them, and that the sense of the church will not turn them into the government. The church will be there to take care of them, not only their spiritual needs, but also their physical needs and their healthcare needs.
The people's faces that attend, they're so grateful, so beautifully grateful to get this quality of medical care. Most people stop me and say, I had no idea this was going to be this big, and with these doctors of this caliber. I mean, we have doctors from the Loyola University Medical Center that are so high caliber, and our nurses and dentists. It's just amazing what we're bringing here: physical therapy, podiatrists, all kinds of screenings and tests.
I screen children from the ages of 1 to 6 years old, and what we look for is corneal refractive errors, that is like astigmatism, nearsightedness, farsightedness, and it is done with an MTI photo screener, which is a camera. And I take 2 photos of their eyes, and with that photo I can detect if there is any sort of eye impairment.
All of us here share the same passion. We're giving our day for people that need medical or dental or any type of health care, and we're doing it free of charge. So that's, I think that vision and that passion, all of us share the same thing, and it's a blessing to be here.